In the clinic, he's always liked the party. He always wanted to get hooked up and go play. He was born early. He was born at 28.5 weeks. He has asthma, and so anytime he's gotten a cold, he always has some kind of respiratory reactions. He started making this weird noise at night when he was sleeping. I recorded it, and I was like, this is an unusual sound. I've never heard this before. We came up for a CT scan, and that's the day that we didn't go home. I didn't know who Dr. Severance was at the time. He sat down, he said, "Hi, I'm Dr. Severance, I'm with pediatric oncology." And at that moment, I was like, time out. I've got to call my husband because I don't want to have this conversation without him.
And then got a call, "Hi, I'm Tyler Severance, I'm an oncologist with MU Health." And, it's kind of etched in your mind, it's something that won't forget.
Bennett was diagnosed with a type of acute lymphoblastic leukemia called T-cell leukemia. It's a cancer of the blood, or more specifically, it's a cancer of the bone marrow.
After a diagnosis, you're thrown a lot of information. You're kind of in shock and just trying to figure out what is happening.
You just have to celebrate whatever milestones you can find along the way. You kind of take it a day at a time, a week at a time. I think there'll be parts of this that obviously with his age he won't remember, but we'll get to remind him like how determined he was and how resilient he was through this. And I think it's just gonna set him up ultimately in life to be a determined person and figure out how to work through any challenge or any battle he might face.
I knew that this was the place that we needed to be because they always made our voice feel valid. I love how all the nurses just take the time and interact and share their love and their joy and their passion for what they do. They treat every patient so special. That's the kind of people I want treating my son. Not just a number, but part of the family.